This show is just loaded, so much so that I can't get it all in, but a couple of doctors, Christine Salter out in St. Louis, dear friend of mine, she is here today to talk about the body's ability to heal itself. Wow. MD talking about the body healing itself. How wonderful. Mark Stingler is a naturopathic medical doctor, an NMD out in San Diego. He's written a new book on prostate, very important for men to read this book. A lot of helpful hints in that. I'm going to open today with COVID-19 and a mold called Aspergillus. What's going on there? And then I'm also going to teach about an old antifungal drug called Griseofulvin being used for cancer care. Why? Join me.
For the past 45 years, I have dedicated my life and my whole career to finding the root cause of disease. And I now know with certainty that we must play a role in our own health care. I'm a self-care advocate, and you know what? Every time you change your diet for the better, exercise, or swallow a nutritional supplement, so are you. Now welcome to Know the Cause.
More and more, we see fungal infections being imparted on people with COVID, recovering or with. Remember, your immune system is down. Fungus is an opportunistic organism. That means when the opportunity arises, boom, it's on board, and it wreaks havoc with your body. In India, we're seeing a plethora of mucormycoses here in the U.S., and in other countries, more aspergillosis. Okay, Aspergillus is a type of fungus. It grows in the ducting systems in your home. It could grow on corn and wheat or peanuts. Our exposure to it, I'm sure, is common. Aspergillus fungal infections and COVID. Scientists, this comes out of the Center for Disease Control here in the U.S. Scientists are still learning about aspergillosis infections caused by the fungus Aspergillus in people with severe COVID-19. In the past, scientists thought aspergillosis occurred almost entirely in people with severely weakened immune systems. However, aspergillosis has been increasingly reported in patients without weakened immune systems, but who have colds, flu, a virus. Okay? Several recent reports describe COVID-19 associated pulmonary aspergillosis, of course, a new acronym in medicine, CAPA. Okay? So let's study CAPA a little bit. COVID-19 associated invasive pulmonary aspergillosis, or CAPA, is a new entity affecting critically ill COVID patients, which, while not well understood, and folks, this is science, while not well understood, has announced itself as a serious threat to those suffering with SARS-CoV-2 infection. In a small study done in Madrid, Spain, the death rate of hospitalized patients with CAPA was 100%. That was in Pharmacy Practice News. Bottom line is, folks, I think to live a healthy life is to be actively antifungal. That's what Know the Cause is all about. I learned this 50 years ago when I got back from Vietnam, had symptoms from head to toe, and we thought it was post-traumatic stress. But lo and behold, I picked up a fungus who lived on board, and I hosted it, and I fed it plenty of alcohol and plenty of sugar and plenty of pizza. And lo and behold, I've realized 50 years ago wasn't good. Now, in my old age, I feel better than I ever have. In my opinion, it was only a matter of time before disease-causing fungi would become apparent in COVID-19 patients. Of course, this happens when your immune system declines, as it does with this particular bug. Fungal infections are not well understood. About 300 species that we humans are exposed to make secondary poisons called mycotoxins. Now, I'll go through this quickly. These poisons are known to be mutagenic, tremorigenic. What is Parkinson's disease? Carcinogenic, genotoxic, teratogenic, and embryotoxic, causes defects to a developing embryo. Neurotoxic, are you kidding? What is Alzheimer's? Nephrotoxic, poisonous to the kidneys, poisonous to the liver, poisonous like venomous bites to the bloodstream. Cardiotoxic, lymphotoxic, dermatotoxic, immunosuppressive, there's the big one. It breaks down the immune system, and these are endocrine disruptors. They alter your, how come I'm hot when it's cold, I'm cold when it's hot? What's with this thyroid or parathyroid? What's with my menstrual cycle? Endocrine disruptors in our environment pretty commonly. So many COVID-19 Aspergillosis infections, why? Over the past several decades, the incidence of nosocomial, that means hospital or medical clinic, fungal infections acquired in a healthcare-associated setting has dramatically increased. Many patients in the hospital, right? These infections are difficult to diagnose and cause high morbidity and mortality, despite antifungal therapy, out of a respected medical journal. So my question, and here's how I want to leave this, folks, with all of you. I try and teach you, and then I want to leave you with some resolve, okay? Can fungal infections be prevented? We are all exposed to germs, fungal and otherwise, every day. Great health is defined as becoming actively involved in minimizing not your exposure, because these fungal germs and bacterial are ubiquitous, they're everywhere, but rather your reactions to those germs. Fungi thrive in sugar-rich environments. Antibiotics, even those taken decades ago when you were a little boy or girl, can have gradual negative effects on your health because they are fungal byproducts. Many supplements have antifungal properties, yet rarely is this known inside a doctor's office. Maybe the very reason supplements like resveratrol, olive leaf, probiotics, omega-3 fatty acids, vitamin D, and a host of others work is because they inhibit fungal growth. Be proactive in preventing fungus from getting aboard your body and injuring your health. I hope that helps. Folks, many of you don't know my great friend of a decade or 15 years, Dr. Mark Stingler. He is an NMD, a naturopathic medical doctor out in the San Diego, California area. Welcome, Dr. Stingler. Thanks for joining us.
Thank you, Doug.
The show is called Know the Cause. I built the framework of this show and the platform around the missing diagnosis. So many people go to the doctor with liver cancer, go to the doctor with a chronic cough, go to the doctor with migraines, and don't know that the underlying pathology has much to do with something that doctor didn't learn in his or her medical training, and that is fungi. Dr. Stingler, I know you. You're the busiest guy I know in the San Diego area. How many of the people who come in believe or have been told by another physician, well, you have this, and then you begin digging? Do you do laboratory tests? How do you diagnose a fungal disorder?
Yeah, basically with our patients, my wife and I, what we do is we take their history, and often with the patient, they haven't been eating well, they got too much simple sugars in their diet, maybe too much alcohol, a lot of antibiotic use for various reasons. Those are tip-offs, should be aware of that. Maybe there's other symptoms, especially things like chronic bloating, indigestion, passing gas. These are all symptoms of fermentation going on with yeast in the gut. Women with chronic vaginal yeast infections, but many other things too, Doug. We also consider things like chronic skin infections. We certainly see a lot of patients with chronic eczema, psoriasis. They have chronic fungal problems, but even things like fatigue, depression, anxiety, hormone balance, all these can be at least in part related to fungal infections. Now, we do run a lot of tests with patients. We want to see what's going on many different levels. One of the tests we run, Doug, with patients, we often do check food sensitivity. Now, part of this panel does check a candida, IgG, which means the immune system has reacted in the past or currently has been reacting long-term to candida. And everyone is shocked because we find a very high percent. I'm talking 75% plus. People show high level.
To what,
and
candida?
So there is some immune reaction going on.
To candida.
For the candida.
That's interesting.
And
Would
so
you say
we see that, and it seems to match up to what's going on. So we don't rely on that. We go more on their symptoms. We treat them and see how they recover. But I'm just saying, we see 75% of people plus are showing high antibody response. We also run a lot of stool tests, and those can be very misleading. I've even talked to people that run the best labs in the country, and they tell you, don't rely on stool tests as a way to diagnose candida. They often do not pick it up. For some reason, their technology is not great there, but that's been my experience.
Dr. Stingler, I worked with a group of doctors out here. They brought me from California 34 years ago here to work with them. They were MDs. And here's what I decided after they ran test after test after test. I'd ask the doctors, look, could we try a little diflucan and nystatin, a couple of weeks? Could you try the Kaufman diet, which tends to starve pathogenic yeast? And within a week or two, they'd come back, some of them crying. They were so happy their headaches were gone or their skin problem was clearing out. How much do you rely on the patient's words and following them for a couple of weeks on an antifungal program?
Oh, we do it, honestly, virtually every day in the clinic. We do it, especially, again, these people have these chronic problems, chronic skin problems, especially the chronic digestive problems, the gas, the bloating, the irritable bowel syndrome. We know about 80% of these patients, they have a fungal problem. It may not be the only issue, but if you don't address it, you're limiting the benefits you can get for the patient. You can take them off all sorts of foods and be in a hypoallergenic diet, but you can only do that for so long. If you address the fungus, the gut heals up, they actually can eat more foods in the future.
Yeah. And this time of year, around holiday time, people tend to lean away from the diet. Come on, grandma's fudge and mom's cookies and so forth. What can that hurt? And the great thing is, you've taught them they own a volume switch. They can turn their symptoms way up or conversely way down. What role does that play in their understanding the role of fungi in their prostate, in their gut, etc.?
Yeah, a lot of my patients have found such pronounced effects when they've done the antifungal protocol. And let's say they stray off their diet and things like that, and the symptoms come back, they pretty much know. I'll maybe get a portal message asking for a refill on their nystatin. Maybe they'll get some refills on their anti-candida herbal products. But they know they can and should do that, but they got to tidy up the diet as well. So, no one's perfect. People get off track, but with these kinds of protocols, they'll respond well like they did in the past.
Just quickly, we only have 40 seconds left. You wrote a book recently called Healing the Prostate. Brilliant book because it covers fungus in the book. How many men who come to you for that problem and reproductive health problems, how many do you think may have a fungal pathology to that?
Well, what we found men with chronic prostate problems, especially prostatitis, inflammation of the prostate, the majority have a fungal problem. I'd say, honestly, 85 to 90%. There's actually some good published data supporting what I have found in my clinical practice as well.
Yeah. Dr. Stingler is an NMD, a naturopath, medical doc. You see, he's trained in all areas of health. If you want to pick up a copy of the book, get it for someone you love, ladies. Healing the Prostate by Dr. Mark Stingler. Salute, sir. Thank you. God bless you.
Thank you.
Thanks. How long have scientists known about fungus? Folks, there's a drug I want to teach you about today. It's called Griseofulvin. I remember reading about it 40, almost 50 years ago, and recommending in an ear, nose, and throat office I was working in, a doctor, an ear, nose, and throat specialist, the drug because it had antifungal properties, and the ear canal is pretty common to have a fungal infection. Okay, I won't digress, but let me teach you about this drug. The drug is called Griseofulvin. Wiki says Griseofulvin was discovered 81 years ago from soil. The soil fungus Penicillium griseofulvum. It is on the World Health Organization's list of essential medicines. Griseofulvin is an antifungal medicine used to treat a number of types of dermatophytoses like ringworm. This includes fungal infections of the nail and scalp, as well as skin, when antifungal creams have not worked. It is taken by mouth, but our skin isn't all that Griseofulvin works on. So I'm reviewing some old data in my file. 14 years ago, a hugely relevant research paper was published, and then, let's get rid of this one. Let me share it with you. Here was the headline. Antibiotic used to treat fungal infections, just also kills cancer, Serge. The researchers say, they say antibiotic, folks. It's antifungal. Remember, bio is life, so truly an antifungal drug is an antibiotic. Due to defects in chromosomal distribution, the majority of tumor cells, cancer cells, would not be able to survive if it weren't for a trick the cancer cells have developed to avoid the chaos in the genetic material. Okay, let's keep going. Antibiotic used to treat fungal infections also kills cancer cells. Scientists of the German Cancer Research Center have discovered that the antibiotic Griseofulvin counteracts this tactic of tumor cells, and thus forces cancer cells to cell death. Okay, question? We now know that Sporanox has become repurposed as not only a toenail fungus drug, but as a cancer drug. This occurred 5 years ago. This, 15 years ago, was discovered. Do you suppose the cancer folks, when they look into, we call it in vitro, it's a laboratory tube or a test. In vivo means where it's taking place inside the body, but in vitro. So you took a bunch of cancer cells, put them in a test tube, dropped some Griseofulvin, just an antifungal, it's dirt-based drug available anywhere, dropped on top of them, boom, 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 cancer cells died. Didn't one oncologist, didn't one medical journal publish, my gosh, we may have a new cancer drug here. One did, and then it was gone. I often wonder if cancer has become, in the US anyway, such a business that we don't want to know its cause. We got guys with 6 times my IQ out there in these medical environments that read a 15-year-old paper and, well, okay, why doesn't someone pick up a $1 drug and give it to cancer patients, okay? This paper represents a 15-year-old discovery that an 80-year-old antifungal drug called Griseofulvin kills cancer cells. And Griseofulvin isn't the only prescriptive antifungal drug that inhibits cancer. We have found Sporanox, Lamisil, Nizoral, Thiabendazole. They've also been used to inhibit cancer. Do any of you have this question? Wait a minute, Doug. Are you saying some cancer is fungus? Precisely what I'm saying. A doctor who says fungus can't cause cancer is an unaware good person. This has been published for decades, that liver cancer is induced by an Aspergillus mold. Very common, we humans are exposed to Aspergillus, mycotoxin called aflatoxin. I mean, it's in peanuts. It can be in our ducting supply. It can be in corn. And no one seems to be studying it. Why would antifungal drugs help cancer patients? Because fungal infections can mimic cancer, so says this journal. Fungal infections, including paracoccidioidomycosis, histoplasmosis, cryptococcus, coccidioidomycosis, aspergillus, mucormycosis, and blastomycosis can mimic both the clinical and radiological findings of lung cancer. Okay, so the question is obvious, why isn't this known? In 2007, the same year that Griseofulvin paper was published, the American Academy of Microbiology here in the US stated this: fungi are the cause of many outbreaks of disease, but are mostly ignored. Fungi can cause a number of life-threatening diseases. Many people, scientists among them, are largely unaware. But you know the good news? You're now aware. I hope that helps. Cleaning my wallet the other day, and I pulled out all these old credit cards and business cards, and I found my Medicare card. I'm 72. I got it when I was 65. I haven't used it yet. Folks, I call it a get-out-of-jail-free card, and I just haven't had the need to use it. Joining me right now is a doctor friend of mine. Gosh, I met Dr. Salter years ago. She's a medical doctor, a chiropractor, an osteopath, a naturopathic doctor, and you put all those together and you get one heck of a doctor. I've worked for doctors who don't take insurance. I've worked for doctors who had a billing room that was soundproof, so the people working in it could scream at the insurance companies for an $8 payment. I know the way you run your business there, and I would do it exactly the same way. I'll go ahead and file, but I can't guarantee anything. Basically, why is it that we feel the doctor's responsible for helping us get better when we've eaten poorly, not exercised, and so forth? Welcome, Dr. Salter. Thank you for joining us.
Thank you. Happy to be here.
Yeah, it's fascinating the way you work. You'll spend hours and hours and hours with a patient, and you're different. You're not another stop on the way to a patient's wellness. You're often the end all. You're often the person that looks at diet, exercise, anger issues, and so forth, and really helps people. Tell us a little bit about what you do there.
Yes, so Doug, I create what's called vibrant health investment programs. They are, you see, we call it VHIP. It's an investment program because it's an investment of time as well as financial resources. We want to work with people who want to invest in their health, who, when I give recommendations for lifestyle, that they're going to take those and actually do that, because I want to see results. I just don't want someone to come and pay me and then not do anything. So I create a personalized program after a really in-depth initial consult. It's not a one-size-fits-all. What one person may need is not what the other person needs. So it could be this person needs IV nutrition because they've got leaky gut, you know, or they may need more bioenergetic, you know, pulse electromagnetic therapy. It just depends. Red light therapy, mitochondrial therapy. It really depends on what they have going on. And I find that out by doing an in-depth exam. We call it our holistic exam, where I look at things from an auricular point of view, from a bioenergetic point of view, from a regular medical point of view, from a Chinese medicine point of view. So we look at all different aspects of the patient to come to a conclusion as to what is their current state of health. And then we support it with regular blood tests looking for inflammatory markers and oxidative stress markers. And we look at all those. And I've tried to find biomarkers that I can follow to say, oh, well, yes, you're improving or you're not improving. And it may take 3 months, it may take 6 months, it may take a year, but we're looking for changes and we're looking for a trajectory that's going in the right direction. We look at body composition. You know, I have patients who say, what weight should I be? And I say, well, let's not focus on your weight. Let's focus on your composition. What's your muscle mass versus your fat mass? Your weight could be great, but you've got a high percentage of body fat. That's what we call the skinny fat people, right? They've got a high percentage of fat, which can be inflammatory. So we want to look at true parameters and not just something that's really superficial. So it's a pretty in-depth program, and it calls for patient participation. And we call our patients practice partners. We call them partners because I'm partnering with this patient. I'm partnering with them on their health journey. They have access to me. They can text me. You know, sometimes they say, oh, I think I need an antibiotic. Well, why do you think that? Well, I've been sick. I've got this, and this. Well, how long have you been sick? 1 day. Well, no, that's probably viral. So let's do our lifestyle. Let's do our fresh fruit and vegetables. Let's do some juicing and some hydrotherapy. Let's make sure you're sleeping well and drinking lots of water. And then you contact me in 24 hours and let me know how you're doing. More often than not, it's like, oh, I'm going the right direction. You know, increase vitamin C, take a homeopathic remedy, take a botanical. And then that way we see, now we need, allow the body to heal itself. That's what needs to happen. Allow the body to do the healing.
That, and they're participating with you, and I think that's the exciting thing. Folks, there's no shortage of doctors. It'll take your credit card and your, insurance card. At some time, you've got to get off this cycle, though, of seeing doctors over and over and over again. You've got to participate. What you need is a teacher and an educator. Dr. Christine Salter, thank you for being with us today. Appreciate you.
Happy to be here. Thank you.
Loaded, right? I mean, it's so amazing when I watch the reruns of our own work, some of which we taped a week or two ago. It just amazes me how much information is in this, folks. I'm not saying don't go to a doctor. I'm not saying don't take the drug that he or she prescribes. I'm saying that after that therapy, it might be a good idea to make another appointment and sit down with the doctor and say, you know what, doc? I read a book on prostatitis written by a doctor in San Diego, or I've learned from a doctor in St. Louis, Missouri, that my body might be able to heal itself. Folks, let me give you a few hints. With the right exercise program, regular exercise program, with the right diet, with the proper supplements, I'm doing it at 72 years young. I feel better than I did at 30 years old. It's really true. You can do this. Thank you so much for joining us today. Thank you for telling your friends to know the cause. God bless. Bye-bye.